Hey everybody, how we doing? Dr. Deom here at Hazleton Eye Specialists for a very special episode of Eyecare Today. If you didn't know, we are located at 3 beautiful locations. We have our flagship, if you will, at Hazleton Eye Specialists on the Airport Beltway. That's 281 Airport Road, Hazel Township, PA. We have our beautiful location in the Poconos, that's Stroudsburg Eye Specialists, located in Tannersville, right down the street from the outlets on Route 611 in Tannersville. And we also have our brand new location in Pottsville. Yes, we are in Schuylkill County, finally. I know you've been waiting for us there in Schuylkill County, and boy, do we love Schuylkill County and all the wonderful, hardworking folks in that area. We're in Pottsville, right on Bacon Street, West Bacon Street in Pottsville. Give us a call. Here's our number. And we cannot wait to see you at one of our 3 locations. And so I thought today, talking about our family in reference to our offices and all the wonderful places and people we're able to serve throughout northeastern Pennsylvania. We have Dr. Tom Kislin, we have Dr. Brendan Connors, our newest doctor, Dr. Corinne Bellinger, and Dr. Brian Olzinski, in addition to our surgical colleagues, Dr. Frank Bucci and Dr. Sushin and Casey Patel, providing retinal surgical care. So that's our family here at the office, but really each and every one of us has our family that really is part of the family here at the office too, and this is my family. And so a few years ago, my wife, Jillian, a doctor of physical therapy that provides home care here to many of you actually out there in the community, joined me with my daughter. She was a little baby like this guy, joined us a few years ago, and we are very excited to bring the whole crew on and talk a little bit about eye care through the years. Okay, so here we have our beautiful little boy. This is Miles. Miles is 8 weeks old. He is brand new, and you can see him looking around, exploring the surroundings here, basically looking for a little bit more, a bottle or some milk, but he is exploring his environment, and look at the smile on this guy. I love it. So Miles is just learning his visual environment. We're going to talk a little bit more about him in just a moment. Yes, that's right. And right here to my side, we have Franklin James. Franklin James is, this is the first time on the show, I believe, or maybe he was on once before. Franklin James, how old are you, buddy? He is this many. That's 3. He just turned 3. And boy, Franklin's visual skills are really blossoming at age 3. So we're going to talk a little bit more about that, and certainly very excited about sharing his visual skills with you. He just got some golf clubs. He's excited about learning all sorts of new sports, and certainly his vision and the way his eyes work are very important in reference to that. So age 3, Franklin James. And of course, who could forget the star of our first show, Bryn Leanne, my daughter, my beautiful little daughter, who is, how old are you, Bryn? She is 4, and as a 4-year-old, we're starting to think about things like kindergarten and preschool, and looking at the board, seeing far, seeing close, and she is a very proud member of daycare in the area, preschool in the area, and certainly she's doing lots of things like learning her letters, starting to think about writing and recognizing letters, words, and associating those things. Certainly your eyeballs matter for those things too, and so you could see how your visual skills do evolve throughout the ages. And of course we have my wonderful wife who has 2 eyeballs also. And, as a mom, you go through all sorts of different changes in your body and around you. Lots of demands on you, with taking care of these guys and everything that we do in our lives. And she's a contact lens wearer and an eyeglass wearer. And certainly we've gone through different iterations of eye care, as a 30 or mid 30-year-old. Okay, so this is eye care through the ages. And so we want you to know that here at Hazleton Eye Specialists, Stroudsburg Eye Specialists, and now Pottsville Eye Specialists, we look at that, blue glasses. That's pretty cool, right? Yeah. We want you to know that we love to see kids and adults of all ages, and especially want to take care of you and your family. So what better way to show you that and display that than to have our family on here today and share a little bit about our eye care and what we do and what we think about when it comes to taking care of everybody's eyes at different ages. So first you might say to yourself, well, when do we start eye exams? When is it important that we first have an eye exam? And so you might be surprised that the first eye exam we recommend is what we call the InfantSEE examination. You've probably heard me talk about the InfantSEE examination before here on the show. The InfantSEE exam is an exam that we do between the ages of 6 months and 1 year of age. So yes, Miles is a little bit young for the InfantSEE exam. We're going to kind of go through some of the things that we do in an InfantSEE exam. But that is our first exam. The wonderful thing about the InfantSEE exam is this. It's quick, it's easy, it's simple, and really, it's more of an educational experience for the parents to let them know about the baby's visual development, what they're seeing, and what they should be looking out for as it relates to any potential issues with their visual development. So when we come back from this very short break, we are going to talk a little bit more about the InfantSEE eye exam and the examination of our younger boys and girls before school age and whether or not that's something that you should be doing for your children. We'll be right back. Hey everybody, Dr. Deom here at Hazleton Eye Specialists, and you're watching another episode of Eyecare Today. If you're looking to get an eye exam, we would encourage you to give us a call at one of our 3 beautiful locations throughout northeastern Pennsylvania. We're at Hazleton location, Hazel Township, Pennsylvania, right on the airport beltway. So give us a call here at the number 570-453-2020. We're also in Stroudsburg at our Tannersville location, right behind the Friendlies on Route 611, down the road from the outlets, right off Interstate 80. Can't miss us there. Give us a call at our office there. We'll get you right in. We have wonderful doctors there and a wide selection of frames and lenses. And we also have our new location in Pottsville. Yes, Pottsville Eye Specialists is ready and raring to go for all of our lovely patients in the Schuylkill County area. And so give us a call there. Here I am today with my family, and you can see you can't script this stuff, right? We got our kids, they're chit-chatting with us. My boy here is pulling on everything, and my son here is spitting up all over us. It's a beautiful thing, but this is the real world. This is life, and I would love to kind of share it here with you. So on the first side of the show here today, we're talking a little bit about InfantSEE eye exams. And so an InfantSEE eye exam is an examination of an infant, typically between the ages of 6 months and 1 year of age. But if you have a concern with your child's vision or their eyes, if there's redness, if an eye is turning inward or outward, if you feel as though there's discharge or anything of that nature, you could always give us a call before the age of 6 months. We often see children just weeks of age, often in conjunction with a referral from a local pediatrician. So definitely there for you with that. So let's say Miles here, our 8-week-old, was in fact a 6-month-old, and we were here going to check his eyes. First thing I'm going to do is take a look at his eyes and see, about his eye alignment. And the best way to do that is to use a special light. So I would take my special light and I'd look in his eyes, and I would look and see what the reflection of the light was from the little flashlight that I was using. Now, based on that reflection of light that I could see on his eyes, I could tell if there is an alignment issue. And this is one of the main concerns that parents, young parents in particular, new parents in particular, have about their infant's vision and their infant's eyes. Are they aligned appropriately? Many times there is what we call a pseudo-esotropia. This is a fake eye turn, pseudo meaning fake, eso meaning inward eye turn. And the main reason for this is, if you look at Miles's nose, his bridge of his nose, you can see he doesn't have much of a bridge of his nose. Now, maybe that came from his mom's bridge. She doesn't have as much of a bridge as I do. Or maybe it's just because he's a little baby, you know, and babies, their nose isn't quite formed. It's not quite developed. Yes, it's not. And because of that, the skin that's there, it looks excessive. So when the baby looks to the left or to the right, which they're often doing because they're searching their environment, it sometimes appears as though there's an eye turn when in fact there's not. So when we look at this eye reflex, we call it the Hirschberg reflex, the light that reflects off the eye, we can measure whether or not the baby has a eye alignment. So if you're wondering, does my baby have straight eyes? We can, measure that with this InfantSEE eye exam. The next thing we're going to do is we're going to try and get some evaluation of the baby's vision. At the age of before 6 months, the baby's not seeing much. They're only seeing shapes and sizes that are probably around 2 to 3 feet in front of them. Around 4 to 6 months, they're starting to see maybe 5 to 6 feet in front of them, and they're going to start to be able to see some ability to see acuity and faces. So we do have a way to evaluate visual acuity. And so you can see here on my phone these bars. And so if you've ever gone driving down the road and you're with someone who's driving and you look out the road and you see the trees and signs going by you, your eyes will follow as fast as they can what's passing you in the car. This is called a nystagmus. And that nystagmus, the beating of your eyes as they're trying to follow what they're looking at outside the car, is a response that's not something that we can control. And so as long as you see things moving, your eyes move. And so we can simulate that by these bars moving across, and we could change the size, the shape, the speed, and the color of these bars. And some of the first colors that babies will see are black and white, and in particular red and white. So we could take this bar pattern and we could put it in front of the baby, and you could see he immediately attends to it, and you could see he is actually very closely watching those bars move from side to side. And so that can tell me, based on the size of these bars, what his visual acuity is. So we can actually tell with relative degrees of certainty and specificity a baby's visual acuity. I could say that he's got 20/40 vision by just being able to see those bars go across the screen. So that's the first thing we're going to do. I would do that with one eye, the other eye, and with both eyes quickly before the baby starts to lose attention and while they're not pooping in mom's lap, right? So we don't have that. And then the next thing we're going to do is we're going to get some estimate of the baby's prescription and make sure they don't have a real high prescription or low prescription. Now, the purpose of this is not necessarily to provide the baby with glasses, but it is to make sure that the baby doesn't have a real high prescription. Babies that have real high prescriptions can develop something called amblyopia, or what was classically known as lazy eye. So what we want to do is we want to make sure, does the baby have a prescription? So you could see here, this is something that we call a retinoscopy rack. And by each one of these lenses is a number, and those numbers will correspond to the power of the glasses that the baby would need. So we use this flashlight and we shine it across the baby's eyes, and we move the lenses in front of the baby's eyes to determine what prescription a baby may have. Now, when babies are born, most of them are farsighted. Their eye is smaller and their vision is what we call farsighted. It means they can see better far than near. Now, that is normal, and we would expect there to be some level of farsightedness early on. So if they have a small amount of farsightedness, that's normal. If there's a high amount, we may recommend prescribing glasses, and that could decrease the likelihood of ever having any sort of amblyopia or lazy eye moving forward. So that we're gonna do. The last thing we're gonna do is actually check the pressure of the eye. We may do what we call a digital tension by just placing our thumbs on the outside of the eye and feeling the pressure of the eye that way. And then the other thing we may do is we might use what's called a tono pen to actually measure the pressure of the eye more specifically. Last, we will dilate the baby's eyes. The easiest patient to dilate is a baby. Why? They have no clue what you're doing. You just pop the drop in and you're all set to go. And then we use this special little miner's light here. It's called a binocular indirect ophthalmoscope to look in the baby's eyes. And this is one of the most important things that we're going to do because it allows us to check to make sure there's no disease inside the baby's eyes. While it is very rare, there is some conditions that we worry about with children. One is the most common cause of childhood eye cancer, and it's called retinoblastoma. So we want to make sure that that's not going on. So we just completed an InfantSEE eye exam on Miles, the newest addition of the Deom family, and he looks like he's pretty happy about it. So stick with us, and we're going to show you what we do when we evaluate a 3- and 4-year-old. Hey everybody, Dr. Deom here at Hazleton Eye Specialists. Another wonderful episode of Eyecare Today. Hope you're enjoying, and I hope you've taken a moment to give us a call and schedule your next eye exam for you or your loved one. We are at 3 different locations. Hazleton Eye Specialists on the Airport Beltway in Hazel Township, Pennsylvania, our flagship location. We're also in the Poconos, Stroudsburg Eye Specialists, located in Tannersville, right down the road from the outlets. And also Pottsville Eye Specialists, our brand new location, beautiful facility, wonderful parking area, wide selection of frames, and we will get you in. You give us a call, we will get you in within 2 days. I guarantee it. Give us a call, we'll get you in within 2 days, Monday through Friday. We'll get you in. Tell them that you heard me say we'll get you in with 2 days, and we will do it. I promise you. So we're very excited to get you in there. We have our brand new doctor, Dr. Connors, Dr. Brennan Connors, really doing a wonderful job down there in Pottsville at our new location. I am here with my beautiful family today. We're talking about eye care through the ages. We just got done talking about Miles and his vision. He cannot get enough of the camera. He just wants to be on it. He is 8 weeks old, and we talked about an InfantSEE eye exam, some of the things that we think about when it comes to eye care. Next, we're going to talk about my daughter, Bryn, and my son, Franklin. Daughter, Bryn, is 4. Son, Franklin, is 3. And I'm going to ask Mom real quick. Mom, we have Bryn and Franklin. We've been blessed. They have very good vision. We've done eye exams for them, and they're seeing well, but we're going to talk a little bit about that. What are some of the things that we think about when, we think about their eyes and their vision over the years here? What are some of the things you think about?
Well, I think right now with Bryn, she's in preschool and she's getting ready for kindergarten. So a big thing that we're thinking about is her vision in the classroom and how it impacts her learning, her letters, her words, her sight words that she's learning. And with Franklin, I think a lot of it is, with his play and, he's doing sports now. So just that he's able to follow the ball and attend to play.
Absolutely. So, this Jill, Dr. Jill here is a professional. So, so she knows these things from her professional background, but she's a mom, right? So she is a mom and I'm a dad. And so, we're speaking from our mom and dad hat right now. What are some of the things we think about? Not only, them poking each other's eyes with different things that they're playing with, which would not be good right on the middle of the show, but also, how they're seeing and what they're seeing, because we take for granted what kids see and that they can see. And so probably one of the most common questions I get from friends of mine is, when should I first get my child's eyes examined? And usually at that point, they're past that infancy stage. They haven't even thought about it at that time. They think, well, my pediatrician has checked their eyes in their office, and usually there is some very basic evaluation of vision at that point. But we really want to know to a higher degree how kids are seeing. So, Bryn, You are how old?
4.
You are 4 years old, and you're in school, right? You go to school, right? Where do you go to school?
Growing years.
We go to Growing Years, yes we do. And so at Growing Years, what are some of the things you do with your teacher? You're learning what?
Not on numbers anymore.
We already learned our numbers, but we learned our numbers, so you had to see those, right? What about letters?
No.
You're not learning your letters, you're done with those.
Yeah.
You learned them, but we had to learn them.
And we're done with rhyming.
And we're done with rhyming.
Anything but except project.
Anything except projects we're doing right now. So, but you heard a couple important things, right? She said numbers, she said letters, she said rhyming words. These are really important skills. Guess what? Each one of them involves vision. So I think we take for granted that our kids do see, can see, and are seeing what they should be seeing. And so we want to make sure that they're seeing what they should be seeing. So bringing your 4-year-old in for an eye exam, extremely important, especially when we're in preschool age. Now, my son over here, he is, as you can see, a little more jumpy, right? He's moving around a little bit more, and I hate to be stereotypical, but boys and girls are definitely different. Certainly we support that in every way possible. Franklin, what are you learning about in school right now?
Are you learning your colors?
Songs. He said songs. Good. What else?
Colors.
Colors. Songs and colors. Wonderful. So, you know, at 3, we're starting to emulate what... And letters. We're starting to emulate what our teachers are doing. So we're repeating, we're listening, we're seeing what our teachers are doing. And they're also starting to think about letters, colors. And one important thing, you're off of letters, good job. One important thing that you want to think about with boys is color vision impairment. And so this is going to be an important opportunity for us to evaluate that. 8% of boys have some level of color vision impairment, something that I see every single day. Doesn't mean that your young boy or girl cannot see colors. It just means they see it differently than you and I. And so again, very important that we get our young 3-year-olds and 4-year-olds examined. Why? Because we're starting to learn, we're starting to see, we're starting to remember. And all of these things start with the very important skill of both eyes seeing clearly in space at the same time. So I'll now switch it over to my wife, all right? So wife, you are wearing contact lenses, and you have long days, busy days. No secret to the folks in TV land out there that have had children. Lots of changes in our body after we have a child. And so tell me a little bit about your experience with contact lenses as it relates to, more recently in our life.
Well, I think more recently there's been a lot more fatigue, a lot more tiredness, which often leads to just some discomfort in my eyes, and especially at night after wearing my contacts all day, being a little more sleep deprived.
Yes. And so one great solution I think that we've come to, for her has been the switch from extended wear contact lenses to daily wear contact lenses. Daily wear contact lenses, if you haven't heard about them and you're a busy professional like us, daily wear contacts are the way to go. Why? You can wear your glasses when you don't have your contacts on and not have to worry about, are my contacts sitting in the case? Are they degrading? Are they becoming contaminated with, allergens or bacteria? You wear them when you want them. When you don't, you toss them away. You don't need them. And you can wear your glasses in the interim to give your eyes a little break. They're definitely the most breathable, highest water content, safest lens to wear. So listen, we had a great time here talking to you about vision through the ages, all the way from 8 weeks up and everything in between. And, boy, we're tired. We're going to need a nap after this. So we are going to go, and we promised them a little surprise. Are you guys ready for a surprise after this?
Yeah.
They're ready for a surprise. I don't know if they totally deserve it. I'm just kidding. Yes, they do. But we're going to go ahead and get them all squared away. So if you or your loved one needs an eye exam, give us a call at one of our 3 locations in Hazleton, Pottsville, or Tannersville, and we cannot wait to see you. Have a great one.